Good evening, guys. I've got B for you. Give me a minute to set up for the show, please, and I'll be right with you. Okay, discussion B deals with geriatric syndromes like falls, delirium, incontinence, sleep disturbances, frailty, and dementia. Okay, the presentation goes through each one of these for you folks. So we're going to go through those tonight for B. So please join me in tonight's presentation. Here we go. Geriatric syndromes like falls, delirium, incontinence, sleep disturbances, frailty, and dementia don't fit neatly into one disease category, but they often overlap and significantly impact quality of life. Here's a practical framework for what to do. Okay, number one, recognize the early signs. Recognize signs early. Many syndromes present subtly, like mild confusion, unsteady gait, or disrupted sleep. Early detection can prevent cascading decline. For example, delirium is a medical emergency, not just old age confusion. Okay, folks. 2. Use a multi dimensional assessment. Geriatricians often assess across 4 domains: cognitive function, ability, functional ability, and overall status. This helps tailor interventions to the individual's needs, folks. Because we are geriatricians, we tailor treatment to their specific problem. A geriatrician focuses on a elderly person. It's an elderly doctor. It's a new term for gerontology. We are called geriatricians. Okay. 3. Address root causes. These syndromes often stem from multiple factors: polypharmacy, main malnutrition, sensory loss, or environmental hazards. A holistic review of medications, diet, and home safety is essential. 4. In multiple engage a multidisciplinary team. Geriatric care benefits from a collaboration. Physicians, nurses, physical therapists, social workers, and caregivers all play a role. Nurse-led models, in particular, have shown promise in improving outcomes for uh, frail older adults. 5. Empower the individual and family. Encourage shared decision making and advanced care planning. Tools like person centered care plans and weighted decision matrix, which you're already skilled at designing, can help navigate complex choices. Would you like to explore how these syndromes intersect with caregiver burnout, or how to build a decision matrix for overlapping conditions? Geriatric syndromes can, can quietly but powerfully intensify caregiver burnout, especially when multiple syndromes overlap. Here's how they intersect. Okay, 1. Increased complexity and time demands. Conditions like dementia, incontinence, or frailty often require round the clock care, folks. Hold on. Be right with you. Supervision, mobility assistance, and frequent medical appointments. This consistent vigilance can erode a caregiver's own routines, sleep, and autonomy. Okay, 2. Emotional toll of cognitive decline. Watching a loved one experience delirium or progressive dementia can be emotionally devastating. Caregivers often report grief, hopelessness, and anticipatory loss, which can lead to compassion fatigue and depression. 3. Physical strain. Tasks like lifting, bathing, or managing falls can cause musculoskeletal injuries, and chronic fatigue when caregivers neglect their own health to prioritize the older adult's needs. Burnout accelerates. Decision fatigue and role overload. Geriatric syndromes often require navigating complex care decisions, medication management, safety modifications, or transitions to higher level care without structured tools like decision matrix, structured tools like decision matrices. You're skilled at this can feel overwhelming. Social isolation, the unpredictability of syndromes like sundowning or incontinence can make caregivers withdraw from social activities, increasing loneliness and reducing access to emotional support. Financial and systematic stress. Many caregivers face out of pocket costs, limited respite options, and fragmented healthcare systems when geriatric syndromes aren't managed. These burdens multiply. Would you like to explore how to design a caregiver support plan that accounts for these syndromes? Or how to use a weighted matrix to prioritize interventions when burnout risk is high? Caregiver stress is real, persistent, and often invisible, especially when geriatric syndromes are involved. But there are powerful evidence-based strategies that can help caregivers like you not just survive, but sustain and even grow through the experience. Here's a breakdown of what works. Mind and body practices, mindfulness, meditation, deep breathing, and progressive muscle relaxation can reduce cortisol levels and improve emotional regulation. Okay. Even 10 minutes a day of guided breathing or body scan can help recenter during chronic caregiving moments. Cognitive reframing, reframing negative thoughts. I'm falling. I'm doing my best in hard situation builds resilience. Journaling or talking with a therapist can help identify and shift unhelpful thoughts, patterns. Physical activity, light exercise like walking, Yoga or stretching improves sleep, mood, and energy. Bonus, it's a form of me time that doesn't require leaving the house. Creative outlets, art, music, gardening, or even puzzles can provide a sense of control and joy. These activities activate different brain regions and offer emotional release. Social connections, support groups, in person or virtual, reduce isolation and minimize the emotional roller coaster. Even brief check ins with friends or neighbors can, can buffer stress. Structured tools, use weighted decision matrix to prioritize tasks or care transitions. This reduces decision fatigue. Time blocking and caregiver calendars help reclaim a sense of order. Professional and community support. Tap into respite care, adult daycare programs, or telehealth counseling. And don't wait for burnout. Proactive support is a sign of strength, not weakness. Would you like help designing a personalized coping plan that aligns with the specific geriatric syndromes you're managing, or one that integrates your decision matrix framework? Okay, guys. So that is B for you. I'll be back on with C shortly. Give me a bit for C, please. And I'll be back on for that. For now, Gator Wellness. Take care, folks.